Nicolette, give consent to be recorded in this video. Hi.
Hi, my name is Nadine Walters. I'm gonna be doing I'm a semester 3 PN student, and I'm gonna be doing your neurological assessment today.
Okay.
Can I have your name and date of birth, please?
Nicolette Walters, October 15th, 1992.
Okay, can I ask you a few questions?
Sure.
Okay, so do you have any history of stroke?
No.
Any brain injury?
No.
Meningitis?
No.
Okay, I'm gonna ask you a few more questions. What month of the year this is?
November.
Do you know the president? The current president?
Joe Biden.
Do you know the prime minister of Canada?
Justin Trudeau.
Okay, and the mayor?
Doug Ford.
And do you know why we're doing this assessment?
Cranial assessment.
Okay, good. So while I was asking her a question, I was checking her demeanor. She's alert. She's know what she's talking about. Have you felt sad lately?
No.
You feel like hurting yourself?
No.
Okay, so I was checking if she was depressed or anything like that, which she's okay. So now I'm gonna go on and I'm gonna be testing the cranial nerve. So first I'm gonna start off with the cranial nerve number 1, which is the olfactory nerve, which I'm gonna have her smell something. So she's gonna close her eyes. And what is that?
Vanilla.
Vanilla is correct. So her cranial nerve number 1 is intact. Second, we're gonna check her cranial nerve number 2, which is the optic nerve. And with that, we do 2 tests. We do confrontational feel and acuity. So first, we're doing the confrontational feel. So I'm going to look for her peripheral vision. Patient stand, or she can sit at this moment. She's not able to stand right now. So she's gonna place one hand over her left eye, and then I'm gonna have her. It's better for her to stand, please. So if we're gonna stand, please. It's okay, stand. Okay. So she's gonna cover her eye, and I'm gonna cover my right eye. So I'm gonna. Ask her 2 on my finger.
2, 4.
Okay. Opposite.
3, 1.
Okay. So her that peripheral nerve is intact. So we're gonna test for acuity. So she's gonna use the Stalin chart, and I'm gonna ask her what line she can see from. She does note that my patient does wear glasses, so with her contacts in, she can see. So what can you see? Line can you read for me?
D F P O T E D. F E L O P Z D.
And with both eyes?
D E F P O T E D.
Okay, so her optic nerve is intact. She can see 20/20 with her glasses. So we're gonna move on to cranial nerve number 3, 4, and 6. So the involuntary shaking of the eye called masticular, which is NYSTAMUS, mastingus. I'm probably not saying it right. So we take a pen light and we're going to hold a 12 to 14 feet from patient nose, and then we're gonna look at the 6 cardinal feel. So okay, perfect. Next, we're gonna look at cranial nerve number 4, which is the cranial nerve number 4, which is the trochlear motor nerves, and we're gonna use the pen light. So would dim the light, and we see how reactive the pupil is to light. And from a distance, the light would, her pupil would be dilated, and we were going to shine the light in from the side, and it should constrict. Her eyes should constrict. So her pupils are now dilated. So we're gonna move in from the side with the light, and her both eyes constrict. So next we're gonna move on to the cranial nerve number 6, which is the abducent cranial nerve. And then we're checking for accommodation. So we're gonna turn the light back on. So we pretend like the light was off. She's gonna be staring at a distant object, which she already did. Her eyes are dilated, and then I'm gonna move inward with my object towards the nose, looking for pupils to constrict, and if they do, they should cross. So as I move in, her eyes are crossed. So then I'll document that pupils are equal, round, reactive to light, and it's accommodate. Next, then we're gonna move on to cranial nerve number 5. So cranial nerve number 5 is the trigeminal nerve, and it's responsible for massification. So I'm gonna check so patients are gonna clench their teeth and bite down. And bite down. And then I'm gonna massage muscular muscles. I'm gonna look at them, and then I feel a round ball. Then I move up to the temporal muscle. And then it should be nice and firm. And then I have patient open her mouth against my resistance. Good. So that nerve is intact. Next, we're gonna go to cranial nerve number 7, which is the facial nerve check. So we're gonna check for facial expression. We're gonna ask patient to close their eyes tightly, then open it. Close your eyes tightly, open it. Then you're gonna frown. You're gonna puff your cheek, and you're gonna smile. So cranial nerve number 7 is intact. And then we're gonna move on to cranial nerve number 8, which is the vestibular nerve, and we're gonna induce one ears. So I'm gonna lean over like that, and I'm gonna whisper something in her ears, and she's gonna say it back to me. Apple cherry.
Apple, cherry. Mango, pineapple.
So her cranial nerve number 8 is intact. Next, we're gonna check cranial nerve number 9, which is the glossopharyngeal muscle, and have patient open their mouth and say ah. So I'm gonna sanitize again. And then I'm gonna be checking her uvula should move upwards. So ah. And then I'm gonna check cranial nerve number 10 as well. So she should have a gag reflex. And so cranial nerve number 10 is intact. She can talk without hoarseness, and she can swallow. So next we're gonna check cranial nerve number 11, which is accessory muscles, and we're gonna have patient move head side to side, up and down, and try to shrug against my resistance. Good. So cranial nerve number 11 is intact, and then we're gonna do cranial nerve number 12, which is the hypoglossal nerve, and then we're gonna have patients stick their tongue out and move it side to side, which cranial nerve number 12 is intact. So this is the end of the cranial nerve system. So Next, we're gonna move to the motor sensory, and we're gonna check for balance. So first, I'm gonna pause the video because my patient has to stand while she does this skill, and she has to walk around. So I have to re-angle my camera. In the motor assessment, and we're gonna check the balance, and we're gonna start off with checking the gait. So we're gonna have patient walk 3 to 6 meters and turn back. So we're checking for normal movement and sense of freedom. The gait should be smooth, rhythmic, and effortless, which that's okay with my patient. She doesn't have any problem doing that. Next, we're gonna check the tandem walk. So we're gonna ask patient to walk straight. Ask patient to walk a straight line in a heel to toe fashion. Good. The person walks straight and stay balanced, so that's good. That's normal. Next, we're gonna have patient do the Romberg test. So you're gonna have, I'm gonna ask patient to stand up and feet together and arms at the side. Yeah. And so patient hand at the side, and ask patient to close eyes and hold the position. So the patient should be able to maintain that position for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 20 seconds is up, so patient has full balance. Next, we're gonna check Romberg test with knee bend. So she's gonna be standing with one knee bend. Come on. Good. So patient, and then she can do the other legs. Good job. Then next, we're gonna check coordination and skill movement and rapid alternating movement. So, patient is gonna sit on a chair. Go. Can you go? Okay. Oh, patient is gonna pat their knees with both hands. Pat knees with both hands. Then you're gonna lift up and turn hands over. Pat the knees with the back of the hand. Do it fast. So put both knees on your arms. Lift up your hands, pat knees, turn hands over and back. Good. Next we're gonna test rapid alternating movement, thumb to finger. So you're gonna use your index finger to touch your finger, then your own nose. So thumb to finger. And then you're gonna do finger to finger test. So that was the finger to finger test. Now she's gonna do finger to nose test. So ask patient to close the eyes and stretch out arms. Ask patient to touch tip of their nose. Good. So patient index fingers alternate hands and increase speed. And she can do that movement smooth. And then she's gonna do heel to shin test. So we're testing the lower extremities of for coordination. So I'm gonna ask my patient to, she should be in a supine position, but at this moment she's unable to. So she's gonna place her heels on the opposite knee and then run it down to the shin from the knee to the ankle. Okay, next time. So the patient can move heels straight down. And that is the end of my video. Thanks for watching.